Bath salts is kind of a very thin veil to what these substances actually are. They generally look like white or off-white powders. They come in these small packets. You can buy them online, buy them in head shops, you can even buy them from dealers. People can ingest bath salts in a whole bunch of different ways. The most common way is by insufflation or nasally. We also see them taking it orally, they take it rectally, and they even inject it into their veins. When people are using bath salts, they're not their normal selves. They're angrier, they're erratic, they're violent, and they're unpredictable. People will start acting really weird. People will start seeing things that aren't there, believing things that aren't true. Some people describe people spying on them, trying to kill them and their families. Other people talk about seeing demons and things that are trying to kill them. What's one of the most concerning things about bath salts is these hallucinations, these paranoid delusions, they will last long after the intoxication's gone. And what we found with some of our patients on the inpatient psychiatric ward is that days, if not weeks, after the last time they used bath salts, that paranoia, those beliefs that there are these evil things out in the world after them, those stick around, and sometimes they last for weeks. We don't have really good treatments for this. Our main goal is to keep people safe while they are experiencing these hallucinations and paranoid delusions, but ultimately these people are jacking up their brains with the stuff that they're doing. Physiological effects of bath salts include chest pain, high blood pressure, fast heart rate, difficulty breathing, brain swelling, seizures, something called excitatory delirium, where people lose control. And there are a number of instances of death directly related to bath salt use. You have no idea between 2 packets of bath salts what compounds are in it, what concentration it is. So some people may be fine after taking one, but they don't know what's going to be in that next packet. And sometimes people get extremely sick. Sometimes people die from what they end up taking. So we are catching people who are using bath salts the symptoms aren't subtle, and both medical and command are aware of what they look like. We are able to test for this. I've seen people turn to bath salts because of stresses in their life, stresses at home, stresses with their family, stresses at work. But I've also seen the bath salts magnify these problems. I've seen patients, and it's well documented that people who use substances, particularly amphetamines like methamphetamine, they can in effect make themselves schizophrenic. That's what we have to call them, just because whatever they do to their brain makes it so that they in effect have one of the most serious psychiatric disorders that we have. I would say, as not just the naval officer, but as your doctor, I think that bath salts not only will jack up your family and your career, they'll jack